Hi, I'm Jeff Bloomberg and I'm the Chief Operating Officer at MGE. And this week's tip is part 2 of a series of 3 that I'm doing on the do's and don'ts of opening additional locations. Now, if you missed last week's tip, you can go ahead and click here and that'll take you to the tip that you missed. So in last week's tip, I went over the 8 questions I'm going to ask a client if they're talking about opening a new location. I talked a bit about the first 3 questions last week, and in this week's tip, we'll pick up with question 4 that I'd normally ask, which is, are you planning on working this office yourself, or are you going to bring in an associate? How is it going to work? Now, the reason behind this is pretty simple. In certain cases, an individual might have an office where they're working very little chairside, and they go to open the second location, and that's great. In a lot of cases, that isn't how it works out, though. Usually, the main doctor owner is working in a location 1 when they want to open location 2. So a few things to consider is, and we talked about this last week, you want location 1 to be functional and doing well before you open location 2, or you're just basically carrying your problems to 2 locations instead of 1. Now, assuming that that's the case, there's a few things you want to consider. First thing is, do you have an associate? I've seen GPs open up a second office without an associate with the idea that they're going to split time. They found an office, it's 45 minutes away from the original office, and it's right close to home, and it's a beautiful location in a new strip mall or whatever, but they don't have an associate. And that usually doesn't end up very well. Usually they end up stressed out, working 6 days a week, and then wishing they hadn't opened the office or looking at how to sell one of the offices. So you don't want to put yourself in that boat. So you absolutely have to have an associate. Now, assuming that you have an associate, there's a few things you want to make sure your associate can do. Number 1, not only are they a good clinician, but they also have to be able to present treatment as well. If you're the primary presenter of treatment, for lack of a better term, closer of treatment, and your associate doesn't have that ability, you're going to have a serious production drop-off if you're taking any time out of Office 1. The other thing that you want to consider is you want to take a look at how leaving Office 1 and depending on your participation in Office 2 is going to affect the bottom line in Office 1. Office 1 is already paying the bills. So you don't want to end up with a situation where you've opened Office 2, you're not really making any profit out of it, yet you're taking a hit from not being in Office 1 anymore. So you want to calculate a few things. For example, let's say you're paying your associate 30% of collections, and by leaving Office 1 2 days a week to start Office 2, the associate picks up an additional $20,000 to $40,000 a month in production and collections that you were doing. Well, that means you're paying an additional $6,000 to $12,000 in associate compensation. Well, maybe that affects your bottom line to the point where you can no longer pay your bills at home. I wouldn't make that trade with the hope that Office 2 is going to pull things off. I'd want to do the math and make sure Office 2 could pull that off, or figure out a way to make Office 1 work to where you're still making a decent income. Ideally, you want Office 1 to stay the same or slightly grow or continue to expand without you actually being there. So you want to calculate how this is going to work. You might also, there's other scenarios. Let's say you have a doctor who primarily places implants 2 or 3 mornings a week. Well, then obviously opening Office 2 is a no-brainer and a pretty easy situation. And there's a couple of other considerations to take into account, whether it's a scratch practice that may only demand your time 1 or 2 days a week, or a busy office that you're taking over, which we're going to talk about in a little bit, in which case you might split time with the associate. But it's very critical that you look at how is this going to affect your bottom line. Next point is, do you want an associate or do you want a partner in location 2? Now, I'm going to give you my opinion. Personally, I'm not a dentist, but if I were opening another location like this, I would want a partner. Why? There's a reason why having a partner, assuming you've picked the right person, which we'll talk about a little bit, is better than having an associate. An associate, in theory, can just quit and open up down the street or whatever, depending on what degree of no-compete clauses you have, which I wouldn't even fixate on that too much. But the key point is you want someone with skin in the game. Why does your office work when you're there? Well, you own it. You have skin in the game. This is yours. You're responsible. And you'll see that, you've probably seen this before, when you're not there, it's not always as productive as it could have been when you're there. Why? Because you're the one in charge. You're the person responsible. No matter how great your staff are, you being there adds that little bit of, oomph. So personally, I would want a partner in location 2, or at least a partner in location 1. It doesn't have to be a 50-50 partner. It could be a 30-70 partner or a 20-80 partner. Really doesn't matter. And there's lots of opportunities for that right now. And in my experience, the locations I've seen where you just stick associates in that work are few and far between, unless there's some mechanism of feeding patients into the practice on a routine basis. If you have a big HMO practice or something like this and the place is going to be busy no matter what you do, fine, right? But obviously we don't promote doing things like that. You'd want to maintain a high quality, preferably as close to fee-for-service practice as you can, in which case you're going to want somebody with skin in the game in location 1 or 2. Now, obviously, you're going to want to do your due diligence on this partner. You might want to bring them in as an associate for a bit, maybe 6 months, 12 months, before you decide whether they're the right person or not. And they should know this as you bring them in, and preferably the terms have been somewhat worked out, early on. But you want to make sure this is somebody you're in effect going to be professionally married to, so you want to make sure that it's going to work. All right? And those are all the questions I'm going to cover for this week with relation to this tip. I'm going to pick up in my next tip where I'm going to finish 8 questions off. Now, if you've liked this tip or you want to see more tips like this, go ahead and click the subscribe button. We put one out, sometimes more than one every week. We hope you've enjoyed them. And if you have any questions about MGE, you can contact us at 800-640-1140 or find us online at mgeonline.com. Thank you.